The Honourable Member for Flin Flon.
Thank you, Madam Speaker. Madam Speaker, the Northern Regional Health Authority serves over 74,000 Northern Manitobans. The Minister has told the NRHA to cut $6 million without consulting with Northerners or the frontline workers. Will the Minister for Health step back from this ill-advised course of action, commit to consulting with Northerners, including First Nations people, on what is best for their health care needs?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, we've been pleased to announce and make investments in the North. Recent announcements in the North for Thompson, several in Thompson, in the Paw and Gillam. We believe in investing in the North, but we also believe in ensuring that there's sustainability for the healthcare system in Manitoba, not just for today, not just for tomorrow, but for our kids and their grandkids. And I believe that Northerners understand that. I believe that those living in southern Manitoba, those in East and the West and in Winnipeg, they all understand the healthcare system needs to be sustainable. That is something the previous government never understood during their 17 years in government, Madam Speaker.
Hear, hear.
The Honourable Member for Flin Flon on a supplementary question.
Madam Speaker, the Premier is forcing unrealistic budgets on the RHAs, cutting non-insured services for thousands of Northerners. We know that cutting non-insured services means cutting mental health supports, but we don't know the full extent of what these cuts mean. Will the Minister for Health table a complete list of those non-insured services that he's planning to chop so that Northerners have an accurate sense of how much damage this is going to cause them?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, this year there are hundreds of millions of dollars more being invested by this government in healthcare than was ever invested under the previous government in 17 years, Madam Speaker. And yet, for some reason, the member, now I recognize that he's a new member to the House, but for some reason he feels that having hundreds of millions of dollars more in healthcare than the previous government did is somehow unrealistic. We consider that to be a strong investment, but we also recognize that there has to be sustainability going forward. I think all Manitobans recognize that we need the healthcare system not just to be there tomorrow, but it has to be there in the future as well. That is the path we are going on to a sustainable healthcare system, Madam Speaker.
The Honourable Member for Flin Flon on a final supplementary.
Thank you, Madam Speaker. Cutting primary health care projects in the North means that more Northerners will have to travel to Winnipeg to get the right kind of treatment.
Yep.
Will the government commit to ensuring that patients who require both insured and non-insured services will get the care that they need without having to worry about the transportation costs?
Hear, hear.
To the Honourable Minister of Health, Seniors and Active Living.
Well, Madam Speaker, we recognize that transportation is a significant issue for many Manitobans, not just in the North, but in different places in Manitoba when it comes to healthcare and getting to the facilities that they need to get that healthcare service. But in particular with the North, we've been very concerned that the federal government refuses to pay the bill that they're required to be paying when it comes to transporting patients from the North to southern Manitoba. Perhaps the member wants to join us in calling on the federal government to ensure that they actually make good on the commitments that they've made and that they're not paying for, Madam Speaker.